We definitely try and educate women on smoking and pregnancy and the risks of smoking and pregnancy, not just for women but their partners and anyone who's in the household who comes into contact with babies. And that is brought up, especially for someone who does smoke, at every appointment. And we have a great team of cessation support workers who go out and see women and supply them with nicotine replacement and advice on use in e-cigs and things like that. It's also brought up when they go for their scan. So any women who books at the booking appointment, their date and scan differs slightly to a non-smoker, and they get educated on the effects of smoking and how that affects the fetus and the placenta.
We don't advise that anybody should drink any alcohol during your pregnancy. We do ask them some questions regarding their alcohol consumption pre-pregnancy, and the advice that we give women is that because of the government guidelines, no more than 14 units a week, and that should be separated out and not kind of saved up for a Friday night or something, because that is actually classed as binge drinking. So it's about a healthier lifestyle so that they can have a healthy family for their healthy future, but we absolutely don't advocate any alcohol to be drunk in pregnancy at all.
With alcohol and drugs, we do an assessment which is based on social needs, and that's kind of involved in that assessment, which asks about alcohol use. We do a screening tool for alcohol use, and women can be referred. For drug use, we have women who can access drug services in the local community, and we would assist them, although it's got to be self-referred. We would assist them, you know, sometimes going with them to appointments if we do have to, just to support them with that.
If somebody's already doing gentle exercise, that's absolutely fine. We wouldn't advertise or advocate somebody starts going to the gym and starts doing press-ups, weights or crunches. It's really not safe, because actually you can end up pulling muscles. During pregnancy you have a hormone called relaxin, which softens those ligaments to allow the pelvis to expand and to the uterus to expand for the growing baby. And women can injure themselves quite easily by doing something and suddenly thinking that they need to get fit. Just keeping fit, keeping sort of generally well, eating a well-balanced diet, making sure that they're washing fruit and vegetables. We don't advocate that they should be eating sort of liver pâtés. Make sure that all their meats are cooked through. They can now have a soft egg, which has pleased quite a lot of women, where we used to say they couldn't, but only if it has the lion stamp on it. They can't have a soft egg if it's from a free-range hen, because we can't guarantee those hens have not got salmonella or been in contact with salmonella.
We are trying to get people into mental health services. We've got some new mental health services that are specifically for perinatal women, but also partners as well. So that's moving forward. So women get seen a lot quicker, and we have a specialist team with Talking Changes who focus on perinatal mental health. And that's all discussed. We'd obviously talk about the woman's previous mental health background with regards to postnatal depression, and it's all done throughout the pregnancy. It should be brought up at every appointment.